Welcome to Falling Through the Cracks. Feel alive and thrive with Dr. Rebecca Risk. Do you ever feel that even though nothing seems seriously wrong and you pass all the medical tests, that you still feel that your health, pain, and fatigue are completely out of control? It doesn't have to be that way. Listen to the tips and suggestions given on our program today and take back control of your health. Now, here is Dr. Rebecca Risk.
Hi, everybody. Welcome back to the show. Today, we're welcoming Dr. Harris Bram, who founded the New Jersey Pain Care Specialist, where he now brings the highest level of pain management care to his patients in central and southern New Jersey. So, Dr. Bram, welcome to the show.
Thank you very much.
How did you get involved in treating pain?
Well, I was involved. My residency is in anesthesiology, and part of being an anesthesiologist is pain control before and after an operation. And at that time, about 20 years ago, I became interested in pain management. Pain management was very new at that time. It was in its embryonic stage. And I decided this is a very interesting field. And I decided to go for additional training after my residency. I did a fellowship training at Thomas Jefferson University Hospital in pain management. And in that training, I gained expertise in acute pain, which is postoperative pain, and what I do now is more of the chronic pain for patients with back pain and neck pain and different types of joint pain.
So, I think everybody listening can relate to something, but with pain, because it's I think impossible to be a human and not have experienced it at some point. But it seems to me traditionally we're quite limited with our options. So what are the options that are laid out for most people to manage pain?
Well, in general, pain, the first thing patients usually do when they have pain is they'll go to the drugstore and they'll try over-the-counter medications such as Motrin or Tylenol. And then if somebody has pain, let's say if it's neck pain or back pain, usually they'll do something conservative treatment such as physical therapy, or they might go to a chiropractor. Acupuncture is also becoming very popular. I become involved when conservative treatments, the more simpler treatments or traditional treatments don't work, and then they come to me for advice in terms of some form of an injection, and it might be an injection in the neck or the back or a joint such as a knee or a shoulder. There are specialists within my field that just focus, let's say, on cancer pain, and they have techniques just for that particular type of pain. But in pain management, there are it's almost as a step ladder. You try medicine, you try therapy, you may try some of the simpler injections, and then there are some very much more sophisticated devices or things that we use, such as implants or things that we place in the body to block pain. So there's a whole array of things that people can do for pain management.
So when somebody, tries, as you said, those traditional things, so Tylenol and, physio and chiropractic, and those things don't work, what is the quality of life of somebody who's experiencing this chronic pain?
The quality of life with chronic pain it can have a minimal impact, or it can have a very devastating impact. Let's take the quality of life for somebody with just on pain medicine. Pain medicines, in general, if there's a lot of literature and there's a lot of press coming out about the pain medications, a lot of the dangers of the pain medications. In general, these medications, they do help patients participate in the activities of daily living. The problem with the pain medicines is they have a lot of side effects, such as nausea, vomiting, constipation, addiction. And by addiction, I mean someone who's taking medicines to get high or to feel euphoria from the medication, and it's not really helping with the pain. It's just they're getting the high from it. And the medications also can lead to death. again, the government is, the United States government is extremely concerned about diversion of these medications. They're with these medications that they're concerned about our youth getting pain medications from their parents or grandparents, going to their medicine cabinets, and then going down the pathway of addiction. So with the medicines can be helpful. They can help to a degree. They never get rid of your pain, and that's something that patients have to understand. That with the medicines, yes, they can help, but you can be tied to them, and they'll only help to. In my personal opinion, for chronic pain medicines, they may help you 20 to 30%. That's what I tell my patients, to be realistic about what the medications can do for you.
That's a pretty small amount, especially if your pain is pretty debilitating, 20 or 30% effectiveness.
Correct.
Yeah.
And what happens is that can we get rid of their pain with increasing the medicine? Yes, we can. If we increase the medicine, the higher you go, the more side effects that you get into, and the potential for death from the medications as well.
Well, and I know that coming off of the medications, if somebody chooses to, or they either realize they're addictive or the pain is cleared, can be difficult as well. There's a bit of a journey involved in just stopping the medication.
Correct. Coming off of the medications, it can be a slow process. It can be a very difficult process. There's the withdrawal symptoms from the medications themselves, which are the nausea, the vomiting. But more involved, what people need to realize is that there's also a feeling that what happens with the pain medications work on what's called the dopamine receptors, and these are pleasure. These are receptors in the brain that are also used for pleasure. What happens is that when you take the pain medications away, the medicines are no longer stimulating these receptors, and the patients just do not feel well for a very prolonged period of time. And it's malaise. They just don't, and it can be for weeks like that. And that's also something that that we have to deal with. Not just withdrawal, the physical, that they don't get nausea, vomiting, diarrhea, but just this feeling, I don't feel good, I have malaise. So coming off the medicines can also be difficult, and you have to be very careful with coming off the medications. It can be dangerous sometimes for the patient. So so again, you have to balance with the patient the positive and the negatives of the medications.
It sounds actually very complicated to even approach that at all, to go on medications and then have all this stuff happening when you already have pain and you're already so uncomfortable.
Correct. And nowadays, again, in the United States, the Federal Drug Administration has just put out guidelines it was predominantly for primary physicians on how to use the medications, how much medicines they should the dose that they should go up to, and it's the way that America is now approaching the medications is different than the way we approached it 20 years ago. Again, going back a little bit in the history, it used to be 20 years ago, doctors were afraid to give the medications. Around the time that a medicine came out, which most patients are probably familiar with, OxyContin, which is long-term Percocet, doctors became more comfortable with giving the medication. There seemed to be literature that yes, it was good to give the medication. The medication is called the fifth vital sign, as opposed to just your blood pressure, your pulse, etc. Pain is also a fifth vital sign, and it changed the whole spectrum of how we treated pain. But now, as time has gone on, we're taking a different look at pain management. The government's taking a different stance on pain medicine through literature, through research, saying really go less is better is really the bottom line. Less medication is better, and the patients, they don't like to hear that, but the data seems to be showing to try to limit how much medications the patients get.
Well, I mean, one thing that you're doing is to help people reduce their pain without using these medications. And one of those things is stem cell therapy. Can you explain to us what that is?
Correct. So what's happened is that we're looking for different types of treatment to try to avoid medications, to try to make the patients more active. And stem cell treatment is a relatively new treatment for pain. And what stem cells are what are called pluripotent cells, or cells that are able to differentiate. In other words, a cell, you have a cell that can maybe differentiate into a tendon or into a muscle. It's a cell that has this capability of changing. And what stem cells are cells that we are able to obtain through the patient's fat, through the abdominal fat, or through the bone marrow, and then we can re-inject them into a part of the body that needs help or needs repair, such as in the knee or a joint, such as a shoulder, and it's a very, very interesting form of treatment.
So the stem cells, of course, like, how long has this been around for? It's making new waves now and people are talking about it, but has it been around for longer?
Okay, so stem cells, the interesting thing about stem cells is actually stem cell therapy has been around for several decades, because stem cells are what are used in patients who are leukemia who have bone marrow transplant. A bone marrow transplant is a stem cell transplant. And that's kind of the interesting, why I became somewhat interested in this, is as a resident, this didn't actually make sense to me. Because if you have a leukemia patient, what is a bone marrow transplant? They take a patient, they find a bone marrow match, somebody who has good bone marrow that you can give to a patient that's sick. They take the sick patient, they give them chemotherapy, they give them radiation, they essentially wipe out their bone marrow. Then what you do is you take the bone marrow, which you aspirate from, or you draw out from the patient's pelvic region, but you infuse it. You don't put it back into the bone. You infuse it intravenously, and then it restarts the patient's own cell lines, and they now produce. Hopefully, they'll produce cell lines that do not have leukemia or lymphoma, for example. So stem cells they've kind of interested me for a long time. So this type of therapy, just the stem cell itself, has been around for several decades. But for pain management, for injecting into patients into different joints, that's probably been around in the area of a decade or so. That has really become more people are showing more interest in pain management and other specialties.
So there's what's the difference between the embryonic and the adult stem cells?
So the embryonic cell is a cell that is just as it is. An embryo is a very it's a newborn. It's not a newborn, but it's embryonic. It's new. It's a new cell and that type of cell is not something that you can inject in the United States. That cell has a potential to many different types of stem cell lines. The adult stem cells are called the mesenchymal stem cells, and those are the ones that we obtain from the bone marrow or the pelvis. And the embryonic cells are the ones obtained from the embryo. Those will be grown in a lab. That's not available in the United States at this time.
Okay, so how does somebody choose if stem cell therapy is the right thing for them to help with their pain?
So typically, the patients that I see, if this is something that they've usually researched this on the internet, they've heard of talk shows such as this, they've possibly have read about it. If somebody comes to me or to choose this type of therapy, I'll want them to try the traditional therapies first, which could be, again, physical therapy, medications, possibly even standard therapies. For example, somebody has knee pain. I will tell them, listen, why don't we try a steroid injection first, maybe some kind of supplementive therapy that you can inject, or what's called viscose supplementive therapy to increase the lubrication in the knee. Stem cell comes in my mind, after that. The reason it comes in after, why doesn't it come in first, is because stem cell is investigational or experimental, and it's not in the traditional line of treatment. So my thought is try traditional things first, see if those work. If those don't work, let's try the stem cell.
Okay. We're going to take a quick break. We're talking today with Dr. Harris Bram about pain management and stem cell therapy and how that can be helpful to you. So tune in after the break. We'll be back shortly.
Your life, your health, your network. You're listening to Voice America Health and Wellness.
The largest syndicated alternative health talk program has come to the Voice America Network. The Dr. Bob Martin Show is the program that will answer your health questions and help you to heal your own body of many different ailments. Each week, you'll hear the answers that Dr. Bob gives to his callers that help them to be their own doctor most of the time. We'll also discuss developments on the healthcare front and what you need to do to keep your body in top form. The Dr. Bob Martin Show airs Wednesday mornings at 9 a.m. Eastern, 6 a.m. Pacific on Voice America Health and Wellness.
We are bombarded with information daily about happy life strategies, beauty products, and business success ideas. Are they truly going to make a change or just take the change out of your pocket? Tune in to Shelley's Show and Tell with host Shelley Hancock. Shelley will explore and recommend proven business ideas, as well as show you how to use the law of attraction to create health, happiness, and a prosperous business. Listen Mondays at 1 p.m. Pacific Time, 4 p.m. Eastern Time on Voice America Health and Wellness.
Your life, your health, your network. You're listening to Voice America Health and Wellness.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back to Falling Through the Cracks. I'm your host, Dr. Rebecca Risk, and today we're speaking with Dr. Harris Bram, and we're talking about stem cell therapy and pain management. So, Dr. Bram, can you just explain to us what it would look like if somebody went through the process to get stem cell therapy?
So, what the procedure looks like is, first, the patient is properly evaluated to make sure that they're a candidate for their procedure. And there are certain things that you want to make sure that they don't have, that there's not an infection where you're going to be injecting into the site. I won't take the stem cells if they have leukemia or lymphoma. So you want to properly evaluate the patient first. Assuming the patient's a good candidate, the patient's put into a procedure room, and then it depends where we take the stem cells next. If we take it from the fat, we take it from just below the belly button. We make a small little incision with a scalpel, and then we put some saline or salt solution that we do basically a mini liposuction. We put about 100 cc's of fluid into the abdomen, and then we suck that back out. We break up the fat with a needle, and we suck out the fat and the fluid together. If we're using bone marrow, the patient's placed on their stomach. Again, these things are done in sterile conditions. We numb up the skin. We insert a needle into the buttocks region, into the pelvic crest, and we take out about 100 cc's of marrow, which is a bloody like fluid that comes out. We then use a centrifuge to spin these samples down, and then we take and then from all this material that we obtain, which is about 100 cc's or so, we get about 7 to 10 cc's that we're able to inject into our target, which could be a hip, a knee, a shoulder, a joint. And so the procedure itself doesn't really take that long, probably with about an hour or so to do.
Okay, and is there any pain associated with this procedure, or is it just the feeling of the injections?
It's just basically the pain is the local anesthetic. That's basically it. When we do for example, for the fat part, where we're using a needle that we're inserting into the abdomen and doing like a mini liposuction and breaking up the fat, we use we mix a local anesthetic into the saline solution so it numbs up the area. For the bone marrow, we don't do that. We just numb up the skin down to the bone, and then the needle breaks through the bone into the bone marrow. It's really, I would say, it's not extremely painful or very painful. Patients seem to me to tolerate it fairly well.
Okay, and then how do they feel after?
Afterwards, they might be a little bit sore. We don't tell them to go out and run a marathon. Just take it easy. Most patients, they're not in a hospital setting. You're not kept overnight. This is an outpatient type procedure. So they walked into the procedure room. They walk out of the procedure room.
Okay, and how long does it take before they start to notice it affects them?
That's a variable. With these types of injections, with stem cell, it can take weeks before you really notice a difference. It's not something you're going to, for example, have a steroid injection and you'll notice possibly within that day or a couple days later. It can take weeks before you notice a change.
And so, if you're talking about the steroid injections, those are reducing pain, but it seems to me the stem cells are doing much more. So how would you compare those two together?
So the steroid injection is an anti-inflammatory injection. Number one, it is taking something. The beauty of the stem cell is you're using the body's own material to help repair something, as opposed to using something outside the body or exogenous to the body, outside the body, and that we're injecting it. And with the steroid, there are risks with the steroids. You can have allergic reaction to a steroid. Is it common? No. It can raise your blood sugar. It has different effects on the body, which you're not going to see with the stem cell. So part of regenerative medicine, by using the body's own material, what I like is that I don't have to worry about this particular risk, an allergic reaction. I just don't have to worry about it with these by injecting the person's own material back into the body.
It sounds a lot better choice to me. I actually was one of those people that reacted to a cortisone shot when I had an accident. I had bursitis in my shoulder, and it was not the right choice for me. That's for sure.
Right. I mean, it does happen, and it's some of these reactions. When you tell a patient, listen, you may have an allergic reaction, this may happen, and it may be some of these things are very rare. But unfortunately, if it happens to you, it's not. It could be a bad scenario.
Yeah. So you do another therapy as well called PRP, and can you tell us what that is?
So platelet-rich plasma is a different form, is a different type of treatment. I would consider this lower grade. If we were talking about putting fertilizer in the ground and then with seeds and growing a plant, imagine that the PRP is like the fertilizer, as opposed to stem cell. The analogy that they use is the stem cell is the seed that you're going to grow from, that's going to grow. So PRP, platelet-rich plasma, is actually a lower type of reparative procedure. What PRP, what involves is, well, let's go back to what's in plasma. When we draw a sample of blood is a mixture of plasma, which is the fluid in which all the cells float in, and you have red cells, you have white cells, which are the red cells for oxygenation, the white cells to fight infection, and then you have the platelets. And the platelets, the key to the platelets is the platelets are the reparative factors in the blood. They repair the little cuts. They help repair different things in the body. So what platelet-rich plasma involves is taking the plasma, which has this mixture of blood, white cells, red cells, and platelets, and concentrating it down to try to get to a very rich platelet fraction, a very rich reparative fraction. And we take that little reparative fraction and we inject it into a ligament or a knee or a shoulder and try to promote relief.
Okay, so are there any negative effects for doing the platelet-rich plasma?
The negative effects would be similar to stem cell. In terms, you're really just injecting the material back into your own body. So I would say it's minimal. There's minimal risk. The only risk is that we do have to draw the material out of your body. We do have to insert a needle and draw out 50 cc's of blood, which is not a lot. And the other risk is not of the PRP itself, or just that we have to insert a needle into a specific area to re-inject this material back into the patient. Again, we are re-injecting the patient's own material back into their body to help repair something.
Well, after our conversation about the side effects and risks of medication, that seems pretty minimal to me.
Yeah, it is. I mean, it is minimal compared to, your other options. I would 100% agree with that. Again, the caveat, the warning here is that we're dealing with, we're dealing in an investigational and experimental type of treatment, but as I tell every patient with whatever procedure that I do, I can't guarantee, no matter what it is, something that's been around for many years that I do, let's say an injection, an epidural steroid injection, which I might do for pain in the back or neck. I always tell the patient there's no guarantees in life. This may help, this may not help. Some people they help, some people they don't help. With PRP and stem cell, it's the same. It's the same warning that I give the patient, but I don't do things that I don't think have a zero chance of working. I'll only personally do things that I think have a chance of success.
So can you give us just an example of somebody where this did work so that people can kind of bring the big picture together?
Where stem
cells helped their pain and how that process went.
Okay, so an example would be I had a woman. She had hip pain. She had tried physical therapy. She had tried other forms of treatment. She had steroid shots, and now her choice was coming down to surgery or no surgery. Now, the one thing with the joint, for example, a hip or a knee, it won't work if you're in a situation where it's called bone on bone, where where the two bones are meeting, there's no joint space whatsoever. These things can help. This particular woman, she had severe arthritis, but she did have some joint space still left. In this particular woman, we did the stem cell, and within a month or two, her pain had markedly decreased. She was feeling much better. This is quite a success. On the PRP side, I had a gentleman just recently. He was on quite a significant dose of pain medications. He had also done the traditional therapies. He had done physical therapy. He had traditional epidural injections. He had an injection called hyaluronidase. He had tried, and he came to me for another alternative. His alternative traditionally would be surgery. Would be one thing he could consider, which he didn't want to do. And I felt that PRP may give him some relief, and it actually did, and his medications markedly decreased.
Well, that's pretty significant, I think. I mean, when we talk about how we don't want to be on, the side effects of the medications and that sort of thing, it's nice to see that there is something obviously more natural because you're using the patient's body and this can help them to change their quality of life and everything else that they're doing.
Correct. I think these are very good options. I have one rule about these things. If I won't do something if I wouldn't do it in myself. In other words, if I wasn't going to do the PRP or stem cell myself, then why would I? If I was in that situation, then why would I offer it to a patient? And so these are things I would do. I have arthritis in my knees also, and I'm not at that stage where I need it right now. But if it came to it before I had surgery, I would definitely try this first before, personally, this is my own personal opinion, before I would go for more knee surgery.
Well, I always think that surgery should be a last resort where you've tried everything else, especially because it can have some side effects itself, and then you've done, the last resort option, in my opinion. So if there's other things that can help us to avoid something so invasive, I think we should always try that first.
I definitely agree with that. Surgery is always the last resort because with surgery, there's no going back. Once you've done something surgical, whether it be the back, the neck, the knee, there is no going back. You can't say, well, maybe we should have done this first. You can't go back. The anatomy has changed. Surgery is always, I agree, is always the last resort.
So are there any contraindications, anybody who shouldn't do stem cell therapy?
Again, the contraindications are somebody who has an infection, whether you're going to be drawing the material from or in the site. Let's say there's an infection, a superficial infection or an infection over a joint or in the joint. You wouldn't want to do a stem cell. Somebody who's on a blood thinner, you probably won't. That's probably not a good idea. Somebody with a leukemia or lymphomas for stem cell or PRP is somebody that you're probably not going to do. Other than that, you can pretty much go ahead with it, except for those few things. So most people would be adequate candidates.
Okay. That sounds like great option as well, with less side effects and okay for most people. And then these results of getting off your medication and being able to get some of your life back as well.
Correct. I mean, getting off medication now in the United States, keeping patients on the lowest dose of medications is what doctors, I think, are really aiming for. And I personally, we need to try, look at all forms of treatment to reduce medications, to reduce the patient's need for medications. And if we have options that are going to help them, make them more mobile, make them happier, I think we should apply them.
I agree. So we are going to take a quick break. We're talking today with Dr. Harris Bram. He is helping us talk about pain and stem cell therapy and how this can help you. So please tune in. We'll be back shortly after this break.
Opinions, options, answers. You're listening to Voice America Health and Wellness.
Hi, I'm John Rainey, Chief Financial Officer of United Airlines, and I'm honored to be the National Chair for the 2015 March for Babies campaign for the March of Dimes. United is a proud supporter of the March of Dimes mission to improve the health of babies and fight premature birth. We're helping the March of Dimes fund breakthroughs in research and community programs that help more mothers have full-term pregnancies and healthy babies. Please join us in working together for stronger, healthier babies. Visit marchofdimes.org.
Frankly Speaking About Cancer is a program designed to empower survivors and their caregivers to deal with the social and emotional challenges of cancer. The show will invite physicians, researchers, nurses, social workers, patients, and caregivers to share their advice on how to live a better life with cancer. Join host Kim Tibaldo, President and CEO of the Cancer Support Community, Tuesday afternoons at 1 p.m. Pacific Time and 4 p.m. Eastern Time on the Voice America Health and Wellness Network.
Opinions, options, answers. You're listening to Voice America Health and Wellness.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back to Falling Through the Cracks. I'm your host, Dr. Rebecca Risk, and we're here today talking with Dr. Harris Bram. He founded the New Jersey Pain Care Specialists, and he deals with pain management as well as stem cell therapy. So, Dr. Bram, I know that we've talked a lot about how the stem cell therapy works, but I know there is some controversy around it. Can you just tell us what that is?
Yeah, there's controversy in terms of where else can this technology be applied? For example, in my office, I have calls probably weekly, patients calling with multiple sclerosis or multiple myeloma or brain injuries, asking about injections. I personally don't do that. I don't. There are people that do these things. I'm not saying that it's controversial, but I don't think there's strong data to support it. Let me just take one step back. In terms of if you were going to ask me, well, doctor, where is the literature to support, let's say, PRP? PRP's main literature, the literature that supports it, is on tennis elbow. That's where they have the most favorable results, which is a tendon type injury. But these therapies are being used around the world for different things, for traumatic brain injury, which I think could be potentially very fascinating, for COPD, which chronic obstructive pulmonary disease. They're doing these things on. But in my opinion is that there's just not enough I think literature to support it. But literature in general, just to support the whole industry, we need a lot more literature to support stem cell and PRP. But in those particular regions, for multiple myeloma, for example, COPD, multiple sclerosis, I think is not as strong.
Well, I know in May there was a case in Canada where they were claiming they cured multiple sclerosis with stem cells, and it was pretty exciting for a lot of people because, of course, it's a pretty debilitating disease. And so you're saying we still need more studies on that to see exactly what
for the
it's
United
doing.
States. Yeah, for the United States, they're going to have to be peer-reviewed journals where, and we're going to have to have more information. These are, I consider those riskier areas, the COPD, especially for traumatic brain injury, where they might be injecting directly into the spinal fluid, these cells. Can you find places around the world, that these things are being done? Sure you can. Even in the United States, there are places that are doing different types of therapies. But, hopefully we'll get more literature to see what areas are best supported. If somebody calls me and says, hey, I have multiple sclerosis, I'm interested in this type of therapy, I'm not going to be doing a procedure in that person, because we have traditional therapies that we know what the results are. I won't be picking up a patient like that. Or for a patient with chronic obstructive pulmonary disease, are therapies great? No, they're not great. They do work. Hopefully we'll get better therapies as time goes along. These people do suffer a lot with breathing problems, but I don't see that we're at that point where we can, at least I personally can't, prescribe this type of treatment.
So it just sounds like it just needs some more time so we can know exactly what the effects are for these more chronic and they are debilitating and diseases, which is a little bit different than the pain that you're talking about, where it's inflammation and joint pain and that kind of thing. They are obviously very, very different.
Correct.
Yeah.
But it is in medicine. We try to take a certain therapy and see, well, where else can we apply this to that it may work, it may help patients, and that's what's happening with stem cell and PRP.
Which sounds like a great option. I think when we look at all the other things, I like the idea of the stem cell, of helping with the pain in that way. It would be great in the future if it could be used for some of these more debilitating illnesses. And so I think that's a great option for later if we have the studies, like you said. Correct.
It's going to be many, many years in the United States before, this ever becomes, if it ever becomes mainstream. It's more likely that these therapies will become approved and more mainstream outside the United States.
So I know, I'm not sure if this is something you want to talk about, but I know some people go outside of the United States for stem cells. And if they do that, because I know that does happen, is there something that they should look out for to make sure that's safe for them?
I can't. I would say, there was just an article in the New York Times where somebody did go outside the United States for stem cell treatment, and it was in Mexico and had a very bad outcome. I think you have to do your research, about where you're going. I think anybody that promises you that something's going to work 100% is probably not giving you the best advice, because nothing in medicine is 100%. I think you have to do your due diligence. I can't tell you, in every country, what to look for, but you have to do your research. You can't just jump at something. You have to investigate the doctors in the clinic and make sure that they are getting good results. Maybe talking to other patients that have gone through the clinic and make sure that they're getting adequate results.
And so in the States, are clinics mostly like what you do with pain management, or you said there are some people doing the more advanced things?
They're mainly what I do, mainly in joints. But there are things that are coming out that they're injecting into disc now for people with degenerative disc. There are people doing that, not in my particular state that I know of, but I know in California they've done a fair amount of work in injecting PRP into disc, or stem cells into disc, into disc, to try to regenerate these discs, and they've gotten some very interesting results. So most of the things in the United States are more traditional into the joints, but there are things where they're moving into disc. There was one guy that was a neurosurgeon that did inject, I believe, PRP into the brain out in California. They seem to be a little bit more progressive out there in California.
Yeah, I think in many things out there.
In many things, that's true.
Yeah. So when are we actually seeing a regeneration of joints and fluid when you're doing stem cells?
You're seeing what you're hoping to see is a regeneration of cartilage, of tendon, of muscle. Are you seeing a pristine joint come out? Somebody who has arthritis? No, you're not seeing that. But what you're hoping to see is regeneration of some of the material in the joint. That's the goal. Now, the science over time is going to show whether that's going to prove itself or not.
Okay. Well, I can imagine if there has been some damage from the arthritis, you can't, I tell people that all the time, you can't turn that around 100%, but you can help to repair some of it, and you can also slow or stop the progress moving forward.
Correct.
And so does stem cell help, does it stop the progress of the arthritis as well, or does it just slow it down by your observation?
I'm not going to be able. I wouldn't be able to answer that. To stop the arthritis, I wouldn't be in a position to answer that. To answer that particular question, it's a good question. I would say that these things, what you're hoping for is, just to help to hold it at bay for a period of time. But is it going to completely stop it from eventually continuing? I don't think I can answer that type of question.
Okay. So do patients often have to come back and get this treatment done again?
Yes. So for these types of treatments, for example, PRP, we'll start with PRP, platelet-rich plasma. I tell patients there is no such thing as one and done. It's usually more than one. I don't give them a number. Hopefully, if it is one, it is one, but it could be 2 or 3 shots. It may be a shot, you do one shot and do another shot a year or 2 later. I mean, there are various scenarios that happen. With stem cell, it seems it's the same scenario where you would do a shot. You may wait 8, 10 weeks, see how the patient's progressing, and possibly do another shot following that.
Okay. And is there a possibility of their symptoms increasing for a short period of time just because you've injected something into the area, so some inflammation?
You mean increasing the pain for a period of time?
Yeah.
Yeah, that does occur, and I warn patients about that. So after, for example, a PRP shot, we tell them, you may increase your pain temporarily. You may see it for a week or two afterwards. Stem cell, the same thing. Maybe with your activity level, decrease your activity level a little bit initially and then build it back up over the next several weeks.
Okay, so just like, a lot of therapies will do that as well because you're stimulating the immune system, and of course you're trying to heal that area, so which is what inflammation is an attempt to heal.
Correct.
So,
it's not uncommon to aggravate something. Even the shots I do, steroid shots that I tell patients, it may aggravate your pain temporarily before you notice a decrease in pain.
Okay. And do they use medication at that time just to keep it down? Is that something you recommend?
Usually it's just Tylenol. It's something simple. For PRP, where you're using the platelets, you don't want a patient to be taking Motrin or Naproxen, Advil, for example, because they can affect the platelets. So you want, for example, PRP, you don't want them to take Motrin before or after, for at least a week before or a week after. So usually what I tell my patients is just to take Tylenol afterwards if you have an increase in pain from a PRP. From the stem cell, depending on how it's done, you may also want to give them the same advice. And if need be, we can give them short-term pain medication that we can prescribe.
Okay. And then they just manage it until it gets better, and then you watch how it goes.
Correct.
Okay. So if somebody's going about looking for this therapy in the United States, how can they find somebody?
Well, most of these doctors that do some form of injection can be found on the internet. If you just put in regenerative medicine, platelet-rich plasma, stem cell, you can usually find somebody in your area. From that point on, you may have to do a little bit more research to find out if, meet this doctor, meet a few of these doctors to see which one would be the best choice for you, like any physician that a patient might be looking for. If you want to see an orthopedist, you might see one orthopedist, then you might get another opinion from another orthopedist just to get an idea of what your options are. So most of the doctors in stem cell and regenerative medicine can be found, many of them through the internet.
Okay. And your clinic is in New Jersey?
That's correct.
Okay. And do you just you treat people mainly in New Jersey, or do you have people travel to you?
I'm mainly in New Jersey. I do see some patients from out of state. I did have a patient that was getting PRP, actually, that was going all the way out to Utah, and I started seeing him, and he was also out of state. But the majority of my patients are from the New York, the tri-state area, the New York, New Jersey area.
Okay, and your clinic has been an establishment for quite a while?
Well, I was with a much larger practice that I established for many years when I came out of my fellowship. This particular practice that I'm the sole practitioner has been around for 4 years, but I've been in practice for over 20 years.
Okay. And so how can somebody find your clinic if they're interested in finding you?
They can find me by the internet, going to www.njpcs.org. They can call me. My telephone number is 732-720-0247. Would be happy to schedule anybody who wants to be seen for an evaluation and see if they're appropriate for this form of treatment.
Okay. And do you have any last minute advice for anybody who's thinking about getting this therapy done?
Again, this type of therapy is very new. People like new things. They like the sound of stem cell. It's a very exciting field. If you're interested in having this done, at least for the patients that I see, I like the patients to go through more traditional therapies first, leave this for later on. The only exception to that rule is an athlete, somebody like Tiger Woods had PRP done, or Dwight Howard. That specific demographic athletes, they need to get back to sports very quickly. They might jump ahead in the line. They don't have time to go through all the therapy, all the medication. They want to get back to activity as soon as possible. That situation is one of the few situations where I'll move them up into an injection, PRP or stem cell, very rapidly.
Okay, so try everything else first, see how it goes, and then assess if stem cell is the right choice for you.
That would be my advice.
Okay. Well, that's great. And I want to thank you so much for joining me today. This was a really great show.
Thank you.
So today we were talking with Dr. Harris Bram. He is a medical doctor who founded the NJ Pain Care Specialists, and he deals with pain management. And we talked today about stem cell therapy. Next week we are going to be talking with Simone Ravix about debunking misconceptions about the brain. So be sure to tune in to hear about that and make today a great day. Thanks so much.
Thank you for tuning in to this week's edition of Falling Through the Cracks. Feel alive and thrive. Please join Dr. Rebecca Risk again next Monday at noon Eastern Time and 9 a.m. Pacific Time on the Voice America Health and Wellness channel. We'll talk more next week.